Yeah.
We're recording. We're recording.
So anyway, it's a great.
We were recording.
No, this is live.
Same here.
Hi, this is Ariel Live TV. Oh my God, I'm so excited today on my studio because we have a lot of guests, and the second guest that I have is a dear friend of mine, and it's been helping the community. But first, I want to introduce the CEO of Silver State Health of Nevada, or .org, Mr. Mark Miyaoka. I want to know what's going on. Mark, welcome to my show.
Thank you, Ariel. I'm honored to be here on your show, and hope that I can share a little bit more about Silver State Health Services and how we're helping the community.
It's so nice that we get to talk to Amy. I know Amy will be winning because I adopted her as a half Asian, half Filipino. She is Amy Wilson, right?
Absolutely, she's part of the family.
Correct. And I'm so thankful that she said yes to me, that she will be getting involved on the chapter. I think that she can be a good mentor, very smart judge. I mean, yeah.
Absolutely, and I'm looking forward to working with Amy.
Yes.
In the future, we talk offline, and we share a lot of the same compassion for the community. We want to help kids, and we want to help homeless people and veterans. So there's a lot of synergies in what we both think about, and so we're hoping that we can collaborate.
Well, she's going to be part of our diversity. I think it will be a good, collaboration or a big help for me because, first of all, she knows what she's talking about. But anyway, let's go back to you, Mark. Behind the scene, I know you said you're not from Las Vegas, you're from California. How did you come over to this hot weather, to the beautiful weather of California? Tell me.
I'm born and raised in Los Angeles, and was raised in a very nice family where my mother was the director for the county health system in Los Angeles. My father was the head of finance for one of the Hughes aircraft divisions, and I was more of a scientist and a geek growing up. I left Los Angeles in 1995, moved to Houston, and developed lots of technology. I was involved in developing imaging systems for all kinds of industries, and came to Las Vegas because I was doing a lot of business. I had lots of business partners here in Las Vegas, and I switched my focus from health services.
Wait, when did you came to? You're so fast. I'm not there yet. Stop.
I'm very.
Are you excited? Are you fast? But anyway, when did you arrive here? Why did you decide what is going on with you? Why Las Vegas?
Right. So I chose Las Vegas in 2018.
Wow.
And I chose to invest in Las Vegas. I chose to participate in the economy of Las Vegas. I felt that Los Angeles was saturated, the opportunities were less, and Las Vegas is really an exciting town, and there's so much opportunity here, and the need is tremendous, and so I felt that Las Vegas was a good place to invest.
So you're basically investors buying properties or helping whoever needed some help or something like that, and you're a gig, you're an engineer, and you end up being in healthcare. So how did you, question to you, how did you get involved the Silver State of Nevada?
Yes, now that's a separate story. That after investing here in Las Vegas, I was basically semi-retired in investments, and I was sitting on the board of directors for Silver State Health Services as the secretary of the board. And while I was there, the company imploded, and the senior management team was removed, and the board of directors was completely changed. And so we had a new board, and we had new leadership. In fact, we had no leadership at the time. And so the board of directors came together and asked if I would be the interim CEO for Silver State Health Services and take it through this period of crisis until they could identify a more permanent CEO. In the event of avoiding bankruptcy, after 6 months, the board of directors felt that I did such a good job in averting bankruptcy and averting catastrophe.
Hold on a second. My guess is so powerful.
Yes.
How
So
did you acquire that position since you're sitting on the board? Because I want to go through this, piece by piece. Okay? Tell me.
right. So as any nonprofit organization, we go through our cycles of ups and downs. And in this particular chapter, Silver State was on a down cycle, and the board of directors had lost confidence in the senior executive and in the present CEO. And so the board of directors elected to have a new CEO take over the company. And that person happened to be myself as the interim CEO. So I went through a 6-month trial period, and after 6 months, they felt that I did such a good job that they wanted me to remain as the permanent CEO.
So that's how you acquired being a CEO with that Silver State, right?
That's correct.
So, and then you decided to make it feel better and stronger and more accessible to the right, people.
That's correct. Growing in the healthcare system, I've seen a lot of poverty. I've seen a lot of low-income families suffer because of the lack of healthcare. And because of my mother's influence in healthcare, I always dreamed about either developing technology or developing a system that would help the community. And even as a young, as a young student, I always had this passion and desire to help the less fortunate. And so it really is God's blessing, because this was completely unplanned, and I just landed into this position of being the interim CEO for Silver State. And I'm really happy that I'm able to turn the image of Silver State around and really impact the community in very positive ways.
What happened when you take over? What did you do when you take over? Who did you actually help already? Because in the past, I've been here since 2000, in 5, and I used to live in San Diego. And of course, I heard a lot about what's going on. How did you manage to basically put it in a position that people trusting the company, trusting the whole team on the Silver State?
Well, I have to tell you that the process of getting people to trust me and believe in me has been a very difficult road. As soon as I became CEO in December of 2020, I was sued immediately. So I had lawsuits that I was fighting. As soon as I took over, there was the legitimacy of my taking over was challenged by external forces. We had outside groups file complaints with the OIG.
Let's talk about that one by one. Why do you think these people wants to sue you? Why do you think they have the right to do that? What's their motive agenda? Why do you think that come up with since you become a CEO?
Well, we never know what's in the hearts and minds of other people, but we do know that having a federally qualified healthcare system provides access from the federal government to provide healthcare and to help the community and to save taxpayer dollars. That's the whole mission. But sometimes people see grant money and instead of using those grant dollars for helping the community, they see opportunities to perhaps
use it in a different way.
Use it in a different way. And so when I took over, I was challenged immediately, and I really had to impact into the organization that we're really here to help the community. And that took some time.
Excuse me for a moment. Can you please tell Dennis to... Thank you so much. I'm so sorry about that. We can hear a lot of voices here. But let me go back. I'm sorry.
So after the immediate lawsuit, there were several complaints filed against me with the OIG, which is the Washington, D.C. Office of Investigative General, and they're at the federal level to investigate the federal use of funds. And I knew that.
But I'm sorry, but you're not involved for that situation because you just took over
That's correct.
the position as a CEO of Silver State. The reason I'm questioning Mark, I have a lot of viewers that want to hear from him. Actually, they sent me a text earlier. They want to hear. So, one of the particular journalists also asked me to question you. So I want they're watching actually right now because we're live. So you took over, and then people are jealous of you because how you did is you did a good thing, and it's just like you're sweeping because you're the janitor cleaning
That's
the room,
correct.
So you become a janitor in cleaning, sweeping everybody, and there you are, they don't like what you're doing. So that's the reason why they're trying to put you in a position in a bad situation because you're all over internet.
And I believe that other people envy to be in the position that I am. There are some people that may want to have the position that I'm in and maybe perhaps have some limelight. But regardless of the motive, I was persecuted by external forces accusing me of wrongdoing. I had whistleblowers notify the IRS. But these, again, like you said, these are events that go back in 2019 before I was the CEO. So really I am like a janitor to clean up a lot of the messes of the past. And move forward in a positive way.
Correct. And there's another person who did wrong to you. U.S. Department of Health and Human Services Office, Council of the Inspector General, OIG. It's a counterpart. This is by the nonprofit subpoena of the nonprofit by OIG Senior Counsel Michael R. Torrisi.
Yes.
So he's also part of that. Why do you think he does not like it? I'm sorry, but this is public.
Yeah.
This is not, privately, it's public. You can see it all over.
Correct.
So why do you think he does not like you?
So,
Why did he put you in a position?
So there's nothing about liking and dislike. When the OIG receives an anonymous complaint, they have to investigate all complaints, regardless of its validity. And so it's the OIG's responsibility to investigate. And the attorney, Michael Torrisi, was the lawyer heading up the case for Silver State Health Services. And we complied with all of his demands and subpoenas of information, and we provided him whatever he wanted to see so that there was complete transparency. And even today I provide him with updates. One of the things that I tell my senior management team is I said, don't worry about being the problem child. I said, sometimes the problem child gets the attention. So sometimes it's negative attention, but Silver State is doing amazing things. And I'm so happy to be working with Seek Jesus First Ministry and with Diversity Chamber of Commerce, because these are amazing programs and collaborations that we're doing to help the community. And these are the things that I want Silver State to focus on. We always get persecuted by people that are envious or jealous, see that we should be doing things a different way or use the money in a different way. But ultimately, all these complaints and all these acquisitions have made Silver State stronger. So we have to just keep things in a positive light, and anytime that we have adversity, we say thank you, God, for bringing us this adversity and helping us become stronger as an organization. Because they point out our weaknesses and they give us an opportunity to improve.
Well, I just want to clarify and let the viewers the reality that the CEO now, Mark Miyaoka, did nothing wrong to the community. What he did is basically, being him as a janitor, he just sweep and clean and make sure the good standing will be applied for on his position now. He's been helping the community. I just want to say thank you also that he did donate $5,000 to Diversity Chamber of Commerce. Then we collaborate to seek Jesus first. What's the mission? We have so many missions. So if you guys want to get involved in the community, just find us. But anyway, I mean, I just want to say thank you for that. And I know you. Why did you decide to build the building if that's I'm sorry because this is the question.
Okay. So, in this business, when you're helping, so we help immigrants, we help refugees, we help low-income families, and we help homeless and veterans. And so we're working with a population that the rest of the society sometimes may shun or have a problem with. And oftentimes, when we set up operations where someone else owns the building, the business owner really has a problem with us bringing homeless people to that location.
Correct.
And over time, we get kicked. Silver State has a 20% ownership, and that has been, it's public information. Michael Teresi, the OIG, has all the documentation, and really, it's about creating stability in terms of not being kicked out by current owners, because in the past that has happened. When you bring homeless when you start treating homeless, landlords and owners get very uncomfortable, and they try to figure out ways of making it difficult.
So you just make it easier and simpler for the company, for the Silver State. That's why you decided that to buy the building.
Yes, in
And
certain
those,
particular cases. Yes.
a lot of people invade you, and the question is, they should come back. They should at least help you because they are part of they're just the past, board of director.
Yeah, and the other thing that I want to let everybody know is that if I do own a building or a percentage of a building, I declare to the board of directors as a potential conflict of interest, and the board of directors will make all the decisions, not me as the CEO. So a lot of the decision making, I basically, if I own a percentage of the building, I will declare that as an investor. I will declare the potential conflict of interest, and the board of directors will make all the decisions. And so I recuse myself from those decisions. If Silver State wants to stay in the building that I have an equity position, or they can choose to go to a different building with different ownership. But like I said, if I'm an investor, then it's harder for Silver State to be removed as a tenant.
All right, guys. I think you hear his side, and what he did is only to make the Silver State health to become better and stronger, and be able to service the community. What their goal and mission in life is basically help everyone. There's no discrimination. Let me read what you write in here. So the company is non-profit organization, 501c3, correct?
That's
Founded
correct.
in 2014.
That's
So
correct.
what year did you get in there?
So I started in 2020.
2020. Okay, so you started in 2020.
So
So
6 years.
20s, and you are providing primary care and behavioral and mental health.
That's
So
correct.
including counseling,
Yes.
management, and you service most likely everyone.
Yeah, mainly our patients are either immigrants, refugees, low-income families, or homeless or veterans. That's kind of our target population. Many of this population are either Medicaid or Medicare patients. A lot of them may have be managed by a managed care organization, or some of them have commercial insurance. But regardless of them having insurance or not having insurance, some people just want to do a cash pay and just go on a cash basis. And so we have a sliding fee based on income. So let's say a typical wellness visit is $100. It can potentially be as low as $20 as based on income. And if they really don't have money to pay, we don't turn anyone away. We try to find donors that will donate the funds so that the person.
We have so many, not just refugees. We have so many here locally that doesn't have any insurance. Single mom, some young generation. Do you think so? They are able, or they are how do you call this? I'm looking for right words. Can they just go there without no hesitation? Like, can they be accepted? They don't need to be turned away.
Yeah, we accept everyone, regardless of age, regardless of nationality, regardless of immigration status. So again, we're not here to report anybody to immigration, whether you're an immigrant
Yes, I have a lot of friends
from out of the country
Filipinos,
and really don't know where to turn to. We are a tremendous source. What we want to do is help people get the care that they need, so that they don't have to go to a hospital that can be very intimidating, and you can wait hours, sometimes 12, 13 hours in the emergency room to get an appointment. You can walk up to our services and get services rendered almost immediately. Might be an hour or two to wait, but we take walk-ups. If you want to schedule an appointment, we take appointments. All you need is to have an ID, a form of identification, and answer a few questions on our application forms, but we will provide services to anyone you need.
So a lot of people then that doesn't have to struggle. They don't have to worry about it, where they're gonna go. Because we have so many immigrants that doesn't have any health insurance, that doesn't know where to go.
That's correct. We are here to help.
So they can just go to 2965 South Jones Corner, Edna in South Jones.
That's
you can't
correct.
miss that. It's a green building.
With the green roof.
The green roof, yes. So I really like your passion, and I know you're semi-retired, but you decided to take this big responsibility that you've been attacked. With the other people, not everybody, other people that does not like you.
Yes, I want to make it in these next few years. I've committed to 5 years, so I have 3.5 more years to serve. And in these next 3.5 years, I hope I can really make an impact on the community and help a lot of people.
I think you are, because the feedback that I'm hearing is mixed, good and bad. So now we're trying to clear the bad things. So he already expressed his feelings, his who he is. So give him a chance. He just take over and clean it. As he said, he was a janitor for over a year now. A year now, right? A year?
That's correct.
Okay, he is a janitor now for over a year. So he still have 3 more years, because you guys have 4 years, correct?
I've been with the company a year and a half.
A year and a half. So you still have 2 years.
3.5 years.
3 years and a half. So 5 years.
Yeah, 5 years total.
Oh, I see. Okay, that's a good position then.
Yes.
5 years.
And then after that, I'll look for my replacement to take over and continue the good works.
I think you don't need to be replaced. You're doing a good job. You're collaborating. We just finished. Now we're still doing a lot of things. I know it, but you did a good job though. It's just June, July. Wow.
Well, in the year, we did over 150% of the previous year. So we're really helping more people, and we're hoping that from the time that I joined to this coming year, that we will double the number of patients that we see.
And you've been opening. You have 6 locations now. You open 6 locations now along Pahrump, along Boulder, and along on
Gillespie, South Point.
Yeah,
Right.
South Point.
So we're trying to spread out so that we know that people have transportation issues, and we want to be convenient for the communities that we serve.
Are you planning to buy a bus or SUV? It's a silver state, service.
That
I
is
think-
that
I
is in
think-
the plans.
I
Yes.
think you can wrap it up with the name of it, the address and the location, how to reach, if you have problem. It's just like 911.
That's correct.
You know what I mean? I think if you put that big number in there, we can help. Everybody are welcome.
Yes.
Reach out, mental health, behavioral primary care, everything, counseling, everything. If we actually put that in there, written on the bus or
Right.
small SUV, and then say, wow, I can call that. Anonymous call, and then we answer.
Right.
How could we help you? There's a bad or whatever, homelessness.
Yes. We do social services. We help with welfare. If people have no income and they qualify for Medicaid or Medicare, we help them through the paperwork. It can be a daunting task to interface with the federal government, so we become like a liaison. And so we provide social work services to help people fill out the applications and get qualified
That's
for Medicaid.
actually also our diversity. So
That's correct, and that's how I would like to collaborate. Is since we have a team of people, we can put them wherever diversity has a community resource center.
Correct.
We would like to help with diversity,
Correct.
so that diversity doesn't have. We'll cover the salaries and we'll cover the payroll for those individuals. And sometimes we get volunteers that like to volunteer their time.
Correct.
But all of our professionals are licensed and certified professionals. So one of the things that anybody that comes to our patient, they know that they're getting
Proper care.
proper care, good prescriptions, not imitations. They're getting credentialed, licensed professionals that are licensed in the state of Nevada.
And we have young lady here also that can help. And I just want to say thank you to her husband for bringing her here today. And she's going to be in our show. But I think you did a good job. And I think to all the bash out there who are trying to attack and hurt a new CEO, he already explained who he is and what he's planned to the longer relationship on the silver state. If he can help the community and other nationality or other people or everybody as diversity, give him a chance. He still have another 2.5 years. So what else do you think you can do to the community? And I know we're trying our best to make this thing happen.
Right. Well, one of the things that Silver State Health Services is concerned about is our youth and our youth programs. And so Silver State has reached out to Clark County School District, and we are a recognized service provider for the Clark County School District. And so we are providing wellness checks, and we're doing sports physicals for the kids of Las Vegas. And already, by the end of this year, we will probably have serviced about 1,000 kids in the community that are low income, and at zero cost to the families to be able to provide sports physicals so that these kids can participate in sports activities.
That's pretty cool. I know you meet, he's actually asking more than Greenway.
Yes.
So I think it's also the sports. He's giving back to the community because if some children that cannot afford, he is also taking it. So that's why he's also asking some fundraising
That's
donation.
correct.
'Cause-
And so we're actually, interested in working with Moreland Greenwood. We would like to provide a lot of the services for these, and at no cost to the families. We're providing the services.
He called me actually and asked me about that. I said, "I'll discuss further since you guys are so busy." So he's supposed to come here also become a co-host. But yeah, I think you have so many projects and you already built so much for the Silver State. You're doing a good job.
Absolutely, and we're looking forward to building our relationship with diversity, because we believe in diversity community resource centers, because these resource centers are going to be so beneficial to all nationalities, all age groups, and all ethnicities. And we're just so excited to be part of diversity.
It's pretty cool. Let me explain to you what is diversity. Diversity Chamber of Commerce, something about it. The reason I created that, I was just overwhelming. We have so many chambers here all over the world. Nevada, we have so many, and I was just decided, why not put together everyone so that we don't discriminate and maybe we can help everyone. The most important that we would like to do is, first of all, we collaborate, you and Seek Jesus First. Shower the homeless, giving them proper care, because the government helped them.
That's
But
correct.
there they are. No one wants to come and really closely help them. But if we can actually put that together and make it happen, then they can get some help from Silver State and Nevada as a mental health and primary care, correct?
That's correct. One of the problems with the homeless population, even Silver State Health Services, has a difficult time taking a homeless person and rendering services because it's really not fair to the other clientele and the other patients for someone who doesn't have proper hygiene to be in the waiting room. So our idea was to provide a homeless hygiene program for a lot of these homeless people. And once they have some sense of hygiene, then they can sit in the waiting room with the other patients.
So that we don't be scared being next to that person and really,
That-
really.
That's
yeah.
correct. So that there's a way that the homeless person can actually have a dialogue. Because now there's not the stigma of someone maybe having an infectious disease or being unclean. And so if they have proper hygiene with clean clothes, nice haircut, then they're just a normal, and these are normal human beings that are just in difficult times. And so what we wanted to do was to create a homeless hygiene before they come into our clinic. And when I heard about diversity and Seek Jesus First Ministries starting a mobile shower, I said this is exactly what the homeless hygiene was intended to do with Silver State. And so I would like to contribute the funds allocated for our homeless hygiene program and help diversity and Seek Jesus First
Well,
Ministries.
actually, thank you for that. Divine also, Dibanat construction company, Terry Cunyado, is also supporting diversity, and I was so happy. He said, oh yeah, don't worry, I'll get you the shower. He said it's better the 3-hour shower, 4 shower.
Right.
Yeah.
I'm
So
really
it's-
excited to see that.
I know, he's looking, Kuya, I know you guys gonna be here tomorrow. Thank you for that. Thank you for supporting the project for giving a shower to everyone. I
Yes.
think it's so fun to shower with that thingy, right?
Well, we're gonna do showers, and not only showers, provide
Mhm.
clean clothes,
Sprinkles,
for
yes.
potentially food and haircut,
Yes.
so that they can really be presentable.
Right, right.
And this will help with job interviews. This will help
Yes.
with getting
We
primary
can give
care.
them a job. We can give them anything that they can do. I know there's so many of them probably are talented painting, you know.
Absolutely.
Drawing, so many things.
Yes, and we really should help this section. There's so many people that just need a small helping hand to get back on their feet. There are a lot of people in the middle class that are one accident or one medical bill away from being homeless. You know, a lot of our families are living month to month, and so if they have a car accident or a medical mishap, then they can't afford to pay their mortgages, and they oftentimes get kicked out of their homes. And these are good, hardworking families. So we want to make sure that we can help these families and help these families get back on their feet.
Correct. I mean, we have so many things that we can actually, share for the community. Can we gonna tackle everybody? But anyway, what's next to you? What's your project after you bought this building in Pahrump?
So the next is 2 projects that we're currently looking at, and really it's up to the board of directors to decide how we move forward. But we're looking forward to opening the Pahrump Medical Center in Pahrump. This is a 17,000 square foot facility that has been dormant for the last 5 years.
Wow.
The county was going to convert it to an office complex, but this was the original hospital, small hospital, community hospital, over 20 years ago. And so what we're looking to do is not resurrect it as a hospital, but resurrect it as a urgent care and primary care facility, so that we're not competing, we're augmenting the local hospitals in Pahrump.
All right, thank you so much. You're going to hear from the CEO, Mark Miyaoka, once a week so that he can update you guys what's going on in Silver State, where they at now, what their vision for the community, and what help can you get from the Silver State. Mark is the CEO. He will give you guys an update once a week. I think it's good for you to give them an update once a week because there's a lot of things that you didn't clean up much.
Yeah, I'm still cleaning.
You're still cleaning. All right, he's still cleaning. So basically, he will give you guys an update once a week. Silver State will have the show here, of course, once a week, so that everybody can be an update. So once again, thank you so much for watching Ariel Live TV. And I just want to say thank you, the CEO, Mark Miyaoka,
Thank you,
for
Ariel.
being here. And of course, once a week, I want you to give them an update because there's so many questions that you still need to answer them. And of course, we cannot bash them out, right?
Absolutely.
What's going on in his building and his project and what he's been doing to the community.
That's right.
Thank you so much.
I look forward to it. Thank you, Ariel.
Thank you so much. Once again, we'll be right back. We have another guest, and she does write grant, and we need her, right?
Yes, we talked offline, and we're looking forward to collaborating.
Oh, we have our secretarian here, so we're gonna have diversity. Is gonna have resource center, community center. We still have to talk about that behind the scene, right?
Yes, we will talk behind the scenes.
Yeah, maybe because we're still live.
But more to come.
More to go.
Lots of exciting things to come.
Yes. So what?